with your carbon mirror platform, how do you actually prove that it's making an impact or a change?
Absolutely, yeah. Just to say, again, it's important to elaborate on what the technologies are. So we have two core pieces of technology. There is a vast knowledge graph that acts as our truth, our knowledge management system that currently houses about 70 billion different nodes and relations within it, all of which are mechanistic. So none of it is mined off the literature. And that we call carbon knowledge. And it's the foundation that the second piece of technology, which is the biology emulator, Carbon Mirror, builds on top. To answer the question first, it's perhaps worth elaborating on the difference between simulation and emulation. So you see, in simulation, to answer your questions about how do you validate a simulation, simulations are interested in mapping out an input to an output without actually trying to understand the true nature of what it is they're mimicking. So all they care about is, as a model, is if I give you a set of inputs, can you tell me some outputs? And that obviously requires validation in a different way because you're not mimicking what actually is that you are simulating. In emulation, however, which is really important in engineering, you're trying to build a computational model that truly reflect what happens at a mechanistic level of the things you are emulating. And the validation to that has a different approach to it. And so I would say we have a retrospective and a prospective different arms of how we validate it. But retrospectively, it should be taken with a different weighing to it because we don't suffer from what traditional machine learning systems suffer from, which is when you are validating retrospectively, there is always a concern that your test set has leaked into your training set. And obviously it's a valid concern if you're doing that. Yeah, because that is like your biggest worry. Have you trained on something that you are like testing the system on? And if so, your whole validation is just invalid, right? Or your whole test set is invalid. We don't have that because we don't have training in our emulation. We are building a mechanistic model of human biology. And therefore, when we retrospectively assess it, it's hypothesis driven. Like it all starts from the science and then it translates into our computational model and gives us an answer. And then we retrospectively evaluate that. But we understand that's not sufficient. So we prospectively look at, say, for example, ongoing clinical trials today and see how can we predict before the outcomes of these trials come based on our technology.